Good morning, everyone. Thank you for joining us, and thank you for the introduction. I'm very happy to be here to discuss some of the things that I'm very passionate about to help educate our public. So, we are talking about tobacco truths. Just as facts that we can find on websites that collect data, if you look here at this presentation, this particular slide says, when you look at abuse of alcohol, HIV, motor vehicle accidents, firearm-related incidents, and illegal drug use, if you combine all these facts together, smoking still kills more people every single year than everything you see here combined. Let that sink in. 10% of adults in New Jersey smoke, which is lower than the national average. The national average is around 14%. So we are making some strides. This is something that most people are surprised at, that research shows that we know types of cancers caused by smoking. There are 12 different cancers, as you can see listed here, and most of these we are more familiar with probably lung cancer because people only think of lung cancer when it comes to tobacco use, but there's also your mouth, stomach, colon, uterine, leukemia, kidney, pancreas, esophagus, your voice box, your larynx. So these 12 cancers we know are caused by smoking. And just because there's a cancer that may not be listed here, like breast cancer, smoking does increase your chances of getting different cancers, although these 12 are linked directly to tobacco use. And when we think about why you can get cancer from smoking, I want to show you between combustible tobacco, meaning the ones you light up traditionally, and the smokeless, the ones that heat up. These chemicals are found in both the non-combustible and combustible. We know there are 699 ingredients that form 7,000 chemicals. Out of the 7,000 chemicals, 70 of them are known carcinogens, anything that do cause cancer. If you look at the vaping, we'll look at acetone. That's both in non-combustible and combustible. Formaldehyde is found in both, and these are known carcinogens. So just take a moment to let that sink in so people understand exactly why these are cancer-causing products. And depending on the ages of certain individuals that smoke, we do understand that there was some information that was hidden. So if you look at the 1930s and 40s, many doctors smoked themselves. And what you see here are not actors. These are doctors that received funding from the tobacco companies. So there was no connection between smoking and cancer, not until the 1950s. It became more clear when the first Surgeon General report came out in 1964. So if you look at what this one says here on the left, not one single case of throat irritation due to smoking Camels. That is not true. But this is what most of my patients that I have that are 60 and older, this is what they were exposed to. So I always tell them, give yourself some grace. You didn't know what smoking could do to the human body. Now we have a new generation, right? We don't have just the older generation. We have people of all ages smoking. We have new trends where numerous celebrities vape publicly. You have Miley Cyrus. She's in the picture to the right. You have Samuel L. Jackson, who's in every Marvel movie. He publicly vapes. We also have Snoop Dogg and Mike Tyson, Hulk Hogan, who passed recently. They all have their own vaping companies and they push these products. Younger people, when I go to the high schools, I did not know who this person was. Top left corner, that's Doja Cat, who had to have a tonsillectomy and cancel her tour years ago because of vaping. And little fact, after canceling her tour, having a tonsillectomy, this picture of her on the Met Gala carpet is her vaping after surgery. So the addiction was never addressed properly. And again, I always mention that information was hidden. If we look here from 1994, this was in every major newspaper in the United States because CEOs of the 7 major U.S. tobacco corporations lied under oath, and they had to redact or should I say not redact because it wasn't hidden, they had to come back and admit that they were lying. They told Congress, and this is the direct quote, "We told Congress under oath that we believe nicotine is not addictive. We told you that smoking is not an addiction and all it takes is willpower to quit." And they had to admit that smoking is very addictive and it is not easy to quit. They manipulated cigarettes to make them more addictive, and there has been research to show one of the additives is ammonia, which is a cleaning agent. The more ammonia that's in the tobacco products, the more nicotine is absorbed, meaning more addiction. They say when you smoke, the nicotine actually changes the brain, and that's why quitting is so hard. When they say changes the brain, we know that the prefrontal cortex in people under the age of 25 is still developing. So the brain does not stop developing up until the age of 25. And if you're smoking before that, your prefrontal cortex that's responsible for decision making becomes compromised, and it's behavior modification changes. Now, we have a lot of individuals who may not use combustible tobacco. One of the trends, younger people do use hookah, but we have to let them know. For instance, in New Jersey, where the Cancer Institute is located in New Brunswick, there are many hookah lounges within the city of New Brunswick. 1 hour of hookah is equivalent to smoking 100 cigarettes. Not only is it the tobacco-related diseases or exposure, it's also you're exposed to the flu, tuberculosis, oral herpes, hepatitis, and COVID, because sometimes they pass around the same pipe by not changing the tip. Some of them have different pipes instead of a single pipe. So this is some precautions we let young people know about. When I mentioned the prefrontal cortex, your brain is still developing. It's not like you can switch out your brain. So when you are smoking before the age of 25, you're at risk for really having some changes to the brain mechanism. This is an example of some smoking products that are on the market. Vaping products, meaning smokeless, meaning not combustible. You don't need to light it. So according to 2024, the National Youth Tobacco Survey, they have over 1.6 million U.S. kids were current e-cigarette users in the year of 2024. Now, we just hit 2026, so the data takes a few years to collect. So while we do know that youth cigarette use has declined, but they are using these products. Everything you see on this page is a tobacco product. That Sharpie, the hoods are made with where you would tie your hood is where the vaping product is. So you're in class using a vaping product, and your teacher, your professor may not even be aware of it. And also the highlighters. One thing I want you to understand is that the companies that make these products deny marketing to children. But if you see with your own eyes, I don't think they're marketing to adults. This is something I use when I go to the high school. This is a slide from the FDA, and it tells you that if you use smokeless tobacco, you're at risk for some type of gum disease. The research shows that when you're using smokeless tobacco, you're decreasing the amount of oxygen going to your gums, which can make you prone to some type of gum disease and tooth loss. We know that there are 30 chemicals found in smokeless tobacco that are linked to cancer. I mentioned before that there are 70 carcinogens in combustible tobacco, whereas there's less carcinogens in smokeless tobacco, but they're still there. 30 of them are there. We know formaldehyde that I mentioned. There's benzene, which is something that is found in batteries. there's nickel and radioactive elements and asbestos that we know can cause cancer. I just wanted to share with you, this is an actual patient of mine. Years ago, the prices actually have come up, but he wanted to join my in-person, pre-COVID, in-person outpatient tobacco group, which used to meet every Thursday from 6 p.m. to 7 p.m. And he told me he did not have a car and it was hard for him to get a bus to reach me. And I just asked out of curiosity, how much are you spending? And he says, oh, they cost around $10.50, and he smoked a pack a day. He had no idea how much he was spending monthly. This is like brief calculations without the tax included. And I told him, you're spending almost over, 300 and change every month. That's equivalent to a car note. And he had no idea. That prompted him to quit smoking more than any health effects that he had. This is that was combustible. Now this is with the smokeless tobacco products, and we know it's more young people using these, and a lot of them get allowances. They may have part-time jobs, and they get money from their parents to buy these products, and they're not cheap either. And depending on how much you smoke, you may be spending more money. And as a clinician, I like to remind some of the people that I'm treating, not only are you causing yourself harm, you're also causing harm to some of the people you care about. From 1964, we have been collecting data that 2.5 million non-smokers have died from tobacco smoke exposure. So that includes heart disease, which takes around 34,000 individuals every single year, and 7,300 individuals die from lung cancer who are not smokers. They're getting sick from secondhand smoke exposure. Just to help people understand, it is an addiction. It has nothing to do with willpower. These are the world's most addictive drugs. Heroin, crack cocaine, and nicotine make the list. Nicotine is just as addictive as heroin and cocaine. Now, as a respiratory therapist, that when I first started my career in the late 90s, I worked at a trauma center downtown Newark, and the trauma team was very good at putting you back together. God forbid you get on the turnpike or the Garden State Parkway, you get into a major accident, they will help save your life. It was an excellent trauma team. However, I worked with clinicians that were using tobacco. Once we would save a life, everyone would gather outside, no matter if it was winter or summer. You would see many people in scrubs smoking. So it is, and these are individuals that went to school, they understand the human body, they know everything about the human body and what causes disease, and they were smokers. Some of my patients who have asthma, that have an asthma pump, as we like to say, or an inhaler, were also smoking, knowing what tobacco did to their asthma. And just as a reminder, it is an addiction. We have a psychoactive ingredient. We talked about it briefly. Nicotine, some ammonia that's added to your tobacco products make you absorb more nicotine, causing you more addiction. When you smoke a cigarette, the nicotine enters your bloodstream through your lungs, and within 8 seconds, it hits your brain. That brain, the brain receives the dopamine, which opens the floodgates for more adrenaline. It ramps up the levels of dopamine, and your brain looks like a bright, lit like the 4th of July fireworks. You take a few puffs, a few drags on that tobacco product that's giving you the nicotine. Then once you're done, those levels start to drop again. And what do? You want to experience that dopamine release. You smoke again to get that hit of dopamine. All I would say is that there are many opportunities to quit, and we provide many quit centers within the state of New Jersey. What we say to individuals, when you're ready to quit, make the decision to quit and set your goals, set a quit date, and have a plan as a backup. I just want everyone to take a moment. If you can scan this QR code and perhaps keep it, on your screen, and I'll bring this back. for later on, let me go back to it. We just want everyone to be able to evaluate the evaluation. If you found any value in this presentation webinar, it helps us make more of these and present them throughout the state of New Jersey. So I'll stop sharing for now. And if we have any questions, I'll put it in the chat afterwards. And I'm all done with the presentation.
Amazing. Thank you so much, Monica. It's very informative. I know myself and others included probably didn't know like a lot of what you were talking about, so it's kind of nice to hear from an expert, which is why we're having this session because, it's nice to have experts kind of explain their history and their story. So, we're going to quickly move into our questions. So, just quickly mention again, please keep yourself on mute. And if you have any questions, please feel free to put them in the chat and we'll get to those later. So, our first question for Monica is how do social, economic, or environmental factors shape those impacted by tobacco use and exposure?
Right. We know that tobacco companies can be a bit predatory. So, depending on what neighborhood you reside in, there are more demographics that have more advertisement. And what we understand is that there are certain groups that are more prone to smoking. We know a lot of veterans tend to smoke. We have individuals who have low socioeconomic status tend to smoke more. Individuals who have received more stress are prone to smoking more.
Okay. That that's great to hear. Or not great to hear, but thank you for the information. And what trends have you noticed in tobacco use over time? So from, I guess, the 60s to now.
Advertisement is different. What we have seen, there's so many, like let's say festivals or some type of event that they will have coupons or they'll table, tobacco companies will table offering free product samples and coupons to get people to try them. So I know there's an organization that had like I want to say a couple summers ago, they had like, let's say a summer fest, and they definitely tabled, and it was geared towards young people. They had samples of disposable vapes, whereas perhaps the young individuals didn't even know they existed, and that became pretty popular. So we have vaping products that you do not need to heat. They're disposable and one-time use, and you could throw them away, whereas before you would have to charge them and then allow them to heat. So now they're just disposable.
Yeah, that's honestly unfortunate that so many companies and like festivals continue doing this. Hopefully we can stop that in the near future. But from your perspective, which tobacco control policies in New Jersey or at your specific workplace at Rutgers Cancer Institute have had the greatest real world impact on reducing exposure and use, and why do you think that is?
One thing I did appreciate is back in 2020, I believe it was, that New Jersey did put a flavor ban in place. If you remember the slide where I had the highlighters and they were all very colorful, those were different flavors like berry, strawberry, cherry. And again, that's really geared towards the youth and not the adult population. New Jersey did ban flavors for vaping products. Unfortunately, menthol is a flavor, but that has not been banned. So I want to say that New Jersey has banned smoking on all beaches, all public places, restaurants, bars. You cannot smoke. So that was very helpful. And we do know that smoking rates are down, but the youth have found different ways to get their products. There's like snus, there's Zen. So these are new products on the market that have a high level of nicotine that I'm concerned about is for brain development in our youth population. So we had made some great strides in banning the flavors. I thought that was really, really helpful for the younger population.
Yeah, it's awesome that we're, taking those steps to ban those flavors. Unfortunately, I'm sure everyone sees that some, smoke shops don't really follow those laws, but hopefully we can get on them in the next couple of months to years and get them to stop doing that.
And I
Um,
also wanted to add to that, I'm glad you did bring up the smoke shops. We have had a lot of posters placed in those smoke shops. It was a huge campaign that if you're under 21, you must show ID. So I thought that was very helpful.
Yeah, no, that's awesome. So these next few questions are kind of respiratory and cancer specific questions. So our first one is, can you explain how smoking specifically impacts cancer patients and individuals with respiratory diseases, including factors such as the biological mechanisms and any potential complications that make smoking particularly dangerous for these populations?
Sure, and I will refer back to one of the slides where there was someone that had a cigarette in one hand and they had an inhaler in the other hand, and that was an asthmatic. What we do know, and why I could say I'm very passionate about this as a registered respiratory therapist, I know firsthand what tobacco does to our lung health, especially. So, whenever you're using a tobacco product, it causes inflammation, and most disease is from an inflammatory part, right? Inflammation is what will have someone not be able to breathe as well. Your bronchial tubes become inflamed and swollen. Instead of having a nice patent airway, those airways get very, very small and it's very hard to breathe. So if you're taking these medications, you're countering what they're supposed to do. They're supposed to open up the airway passages to allow air in, and if you're smoking, you're causing inflammation, causing them to tighten. When it comes to our cancer patients, we know even before your first cancer treatment, by not smoking, you're improving your health and your cancer. Our cancer patients who have uh, unfortunately, they have a new diagnosis of cancer and they're still smoking. So we know that the stress associated with being diagnosed with cancer and having to smoke is not an automatic, and to having to quit smoking, it's not an automatic fix that that individual will stop smoking because they have cancer. Sometimes they tend to want to smoke more because they feel like, I have cancer already, what's the point?
Yeah. And so that kind of leads us into our next question, which is, so what are some of the significant physical, emotional, or even psychological damages and challenges that cancer patients or patients with respiratory illnesses face when trying to quit smoking? I know you had mentioned they're kind of like almost they have given up to a certain extent. They feel like they have cancer. What's the point of smoking? So can you tell me a little bit more about some of those challenges?
Yes, and that's why I say we have to understand there's a psychological component. And one of the best things that most cancer centers have are teams. It's not just one person is treating you and the other person on the team is not aware of the treatment. So it's an interdisciplinary approach. So I'm part of a team that when a patient gets diagnosed, social work is part of the team. We may even have to bring on a psychologist to offer counseling. We meet the patients where they are. When you're newly diagnosed, you may not feel like you're ready to quit. Today is Thursday, you went to the doctor, you have a new diagnosis, and they say we need to refer you to tobacco treatment. They're not ready for a tobacco treatment. So it's up to us to be able to understand that that patient may not be ready now, but we can talk to them about the benefits of not using tobacco and how their cancer treatment outcomes will benefit from not having tobacco in their system. And we just set a goal and counsel them until they do become ready to quit. We meet them where they are. Some patients are into reduced smoking. If they smoked 20 cigarettes a day, they're able to reduce by 3 a day. And that's progress. And some are able to say, I'm ready to take the nicotine replacement medication, and they quit on the same day. So I think having an interdisciplinary approach when treating the patient increases their success rate to becoming tobacco free.
Yeah. And
I hope
so,
I answered that.
yeah, no. And so how do you think these challenges faced by cancer patients, respiratory patients, may differ from just the rest of the population? So maybe the quote unquote people who don't have cancer don't have any, pre-existing conditions. How do you think that differs?
Well, a lot of them feel guilt. Like, for instance, there's something called COPD, which is chronic obstructive pulmonary disease. That's the sixth leading cause of death in the United States, between five and six leading cause of death, if I'm not mistaken. And that's a chronic disease, so it doesn't go away, and there are four different stages of COPD. So when those individuals hear that they're diagnosed, they feel guilty and they feel like, why even do anything now? I already have it. And the same thing with cancer patients. But we let them know there's so many new modalities on the market. There's so many treatment with research working for the Rutgers Cancer Institute. We know that there's gene therapy that targets that specific cancer. There are surgeries for COPD patients that open the airways. They have so many different innovations that help prolong life. So we let them know this is not the end. We can actually help you live a better quality of life while going through these treatments.
Yeah, that's great. And kind of going back to the trends portion of it, what current trends or developments are you observing in cancer care, respiratory care, related to smoking behavior, prevention, and cessation? And for example, are there new interventions or patient education strategies, that are looking promising?
Right. So what we tend to know is that there are different ways to provide tobacco treatment. You can have group therapy, you can have individualized therapy. We know that there are some text messaging services that send updates. They allow people to see how much money they saved or how many years they put back on their lives. Because we know smokers tend to they live 10 years less than people who do not smoke. So with cancer patients specifically that do not have sometimes the strength to be able to join a group session the day that they had their therapy and they can't make it, we automatically let them know that does not negate your ability to still get treatment. We offer individual therapy. We have people that say, I'm really exhausted right now. I can't make group. And I say, that's fine. Then we make it very easy by not having them have to come back to the clinic. The first thing all my cancer patients will say to me, do I have to come back? Because, I have therapy tomorrow and I'm not going to have time to do tobacco treatment and I'm not due back in the clinic for another week and a half. And I say, no, I will deal with you the way you'd like me to. If you prefer to do telehealth, if you want to do like we are now on Zoom or Teams, however it works for you, we meet them where they are. And some family members have been encouraged to be a support system for their family members to be able to quit smoking, and sometimes being held accountable to individuals, I think helps also.
Yeah, that's awesome. I love that to hear that family members and loved ones are kind of included in the quitting process. I think that's really great. And kind of moving on to a little bit more about just the quitting process in general. How does the process of quitting smoking differ for patients with cancer, chronic respiratory illnesses, compared to the average smoker in terms of medical management, support systems, or even treatment goals?
Right, and that's kind of probably like summing it up in terms of the interdisciplinary approach, whereas we have some people that may need additional counseling, and I'm able to reach out to one of my colleagues that's a psychosocial person, and they will be able to provide additional support in addition to the medications. We know the American Lung Association has a program dedicated to the youth population only, whereas they can have these programs within the schools where kids that are vaping can find tobacco treatment. And when it comes back to chronic lung disease and the cancer patients, we make it easier for them to get the counseling, opposed to like a traditional 8-week program. You meet once a week and you receive medications. you may have to be with someone for 6 months of counseling. It may not be every day. They may quit and stop again. We know most people, it takes around maybe 8 times before you can finally quit. And we tell them to not give up. Just because you may have relapsed, that's one thing we want our cancer patients to know and our chronic lung disease patients to know especially. If you do relapse during your treatment journey, that doesn't mean you give up. You just start again and pick up from where you were.
Yeah, that's very true. Very real. And so moving on to cessation support, everyone in this room, works with people. We're all here to kind of help improve the health of New Jersey. So in what ways can people like tobacco cessation specialists, healthcare providers, and public health professionals, and even social service workers, collaborate to enhance the quitting experience for cancer and respiratory patients?
So basically, I'm going to go back to the medical side of things. If I could make these changes, tobacco is tobacco use tobacco use disorder is, to me, should be listed as a chronic disease. When I go into the EMR, the electronic medical records, tobacco use is not under a chronic disease. It's under social determinants of health. And that's one of the problems. If we treated it like a chronic disease, we would have more resources and more eyes on the disease. People have to understand that it's like another vital sign. Every time a person sees a physician, they should be asked about their tobacco smoking status. The same way your weight is taken, especially now the holidays are over. If you checked my weight in December or start of November, the holiday season, and you check it now, it may not be the same. So the number you recorded before may not be the number you see now. The same thing, if you asked about my smoking status back in October, you should be asking me if I have an appointment in November, what is my smoking status? Once we make this something that's more prioritized, I think it would be helpful. I'm actually working on a quality improvement project right now to prioritize asking smoking status and documenting it in the chart where all the team members can see the person's smoking status. The same way if you had a high blood pressure, it would be a red arrow next to it to bring that to someone's attention. I think if we change our attitude and make tobacco disease, tobacco use disorder, a chronic disease, there would be more eyes on it. The same urgency as with diabetes, that should be the same urgency with tobacco use.
Yeah. And you kind of talked about this a little bit in your last answer, but so are there any particular strategies, maybe care models, or even community partnerships that you think show the most promise as far as kind of combating tobacco use disorder and also just providing resources to the general public as well as cancer patients, respiratory patients?
Yes, education, education, education. Whenever we have awareness campaigns, I think that's very helpful. We know November is Lung Cancer Awareness Month, the Great American Smokeout. There's World No Tobacco Day. There's so many different opportunities to provide education, like all these community events that we have, and hoping that we find more resources within our states, because I know some federal funding has been made perhaps reduced or diminished in the areas of tobacco use, and just I want to say partnering with different organizations to bring about tobacco use awareness. I think that's very helpful, and I'm hoping that we do more state funding opposed to looking to the federal government to get help, because that may be dwindling. Like we have the quit centers throughout the state of New Jersey and or throughout the country actually. And I know depending on where you are, some have mentioned that they may not have as much funding in this year that they did in previous years. So we have to find different resources to make sure that the awareness is there. Having the high schools have tobacco awareness days where they can invite someone like myself, educators come in and talk about it. The American Lung Association, as I mentioned, they have a program that social workers in the schools, counselors in the schools, teachers in the schools they can implement. So I'm hoping that with what we are doing now brings more awareness and for more people to say, we need that. We know smoking, or I should say smokeless tobacco use, is starting in the middle schools where that's like 12, not just high schools. So there's campaigns to address the 12-year-olds in middle school also.
Yeah, it's honestly really interesting to me that, it's not the first thing doctors ask because I'm sure as anyone who signed up for health insurance knows it's one of the first things they ask. And if you are a smoker, your health insurance premiums go way up from if you weren't a smoker. So it's upsetting to hear that doctors aren't more, like, it's not one of the first things they ask, but hopefully in the future we can get it. So it's like you said, almost like a vital, like you take your blood pressure, you take your heart rate. Are you still smoking? Have you ever smoked? Etc.
Yeah.
Yeah.
And we have to educate our primary care physicians also to ask that question because usually if you get diagnosed and you see a specialist, that may be one of their questions. Like OBGYNs should be asking their patients, do you smoke? Because that would be helpful. Tobacco use causes inflammation, and a lot of disease starts that way. So if we know from all different sectors, one thing I can say that's been very helpful, we have our dentists or anyone specializing in the oral diseases, they're very prone to asking patients about their smoking status. So that's very helpful.
Yeah, that's really helpful as well. Well, thank you so much for answering all of these questions. I'm actually going to turn it over to everyone else. So if you have any questions, comments, feel free to either put it in the chat, take yourself off mute. S- Monica is here. She's like available to answer these questions, so I would definitely take advantage of it. So I will stop talking for a little bit just to see if anyone has any questions. And yeah, then we'll move on after that to a little bit of resources and then yeah. Alrighty.
If no one has questions right now, I just want to point out with insurance, right, we have to see what we can do with getting more of these treatments covered because I've come into challenges where sometimes nicotine replacement products are not always covered by insurance and people have to pay out of pocket and that's where the quit centers come in and I'm hoping that we do more funding within our states or within our individual cities.
Yeah, and Dustin actually had a great question. So, what do you find to be the most helpful when talking to youth about tobacco use?
Not lecturing them and giving them facts and letting them know, like especially the athletes, when you talk about the chemistry and what it can do to reduce their ability to enjoy their sports. Some people are looking for scholarship opportunities, and that kind of perks them up. And sometimes you appeal to the vanity of some of the both the female and male high schoolers. We talk about the wrinkles that they may have. Yes, there are health conditions, yes, but that may not be the first thing they're thinking because they're invincible. So you talk about the things that matter to them.
Perfect. I mean, I know a lot of us work with youth, and a lot of times the youth will even come up to me and be like, I didn't even know vaping was a problem. So it's kind of hard to get through to them. So, yeah, that's a great question. Thank you, Dustin. And Jenna, looks like you have a question as well. Feel free to take yourself off mute, put it in the chat, whatever works for you.
Hi, everybody. Good morning. Thank you, Monica, and thank you, Juliet. My name is Jenna. I oversee the Regional Chronic Disease Prevention Coalition, and a lot of what we do is talk about, the impacts of smoking, tobacco use, vaping, on our overall health. So thank you for this topic. My question is this. You talked a lot about nicotine and how dangerous that can be as far as becoming addictive, et cetera. I've been seeing some other things coming out about nicotine, like the use of nicotine patches for other health benefits, particularly around like Parkinson's and dementia. And I'm just like to help with those things, alleviating symptoms and slowing progression. And I'm just wondering, of course, this is controversial. So I'm just wondering if you, Monica, know of anything that has been related to these conversations from your perspective.
So that's a very good question. With the nicotine patches and the diseases you mentioned are not really for a lot younger people, right? So we would assume this is not like our high schoolers or under the age of 25. Nicotine itself is not harming you. So if nicotine has become a benefit, that's something we encourage. What we know is that, unfortunately, it's all the other chemicals that are found in tobacco smoke. So that's why we do prescribe nicotine patches, nicotine gum, nicotine lozenges. So it's not so much frowned upon as using nicotine for different benefits, but it's more so the brain development in young individuals. So I think it's a very good question, and nicotine does have some benefits, but when we talk about the younger population, it's more so for the brain development and behavioral modifications, etc.
Excellent. Thank you. So just differentiating for the different age groups would be helpful and the brain development piece for the younger generation.
Yes,
Okay. Thank you so much.
absolutely. Yes, you're welcome. Thank you.
Right. And if we don't have any questions, I'm going to move on to our resource section, but just want to give everybody one last chance to put any questions in the chat. Raise your hand. Just feel free to come off mute. You don't even have to raise your hand. Um, and yeah. All right. So I will start sharing, but once again, feel free to put any questions in the chat if something comes to you. Okay. Sorry, give me one second. All right. And everyone can see my screen? Yeah. Okay, great. So, thank you again, Monica. Your, wisdom, it's super important. We really appreciate having you, especially having you as our first expert. It means a lot to us, and I'm sure it means a lot to everyone here as well to get this knowledge and this information. Again, something that is so prevalent and, kind of scary almost to think about how it's affecting our youth and also just how it's affecting the health of New Jersey in general. So, I just want to give a few resources.
And
So,
I will put the QR code in the chat. I
oh
will
yeah,
do that
perfect.
now. Thank you.
We have some great resources in New Jersey. We have New Jersey Quit Line, which is a free 24/7 hotline available for people who are looking to quit tobacco or nicotine. We have certified quit coaches, and there is access to an online portal with digital resources. Qualified callers, which is most people who call, will receive 2 weeks of free nicotine patches, which is great because they can be kind of expensive at the pharmacy. So it's nice to see if they work for you before you kind of commit to buying them at the pharmacy. We also have Mom's Quick Connection, which is for families with children under the age or 8 years old or under. And this is helping those who care for this child 7 years old or younger to quit smoking. It's actually 8 years old or younger. And there's unlimited counseling sessions, personalized quit plans, and resources to prevent relapse. And we also have our quit centers. So if you're interested in quitting with a support group, New Jersey Quit Centers could be the resource for you. They provide free NRT for those who qualify and also counseling, both group and individual counseling. And there's a quit center in 11 counties. So I always say if there's not a quit center in your county, there's one in the county right next to you. They're always accessible, and they're free of charge, of course. So I kind of talked about each of these a little bit more, but I'm gonna give a little bit more information. So for New Jersey Quit Line, this is available for youth between the ages of 13 and 17, and also adults over the age of 18. You must be ready to quit for New Jersey Quit Line, and it is 24/7 telephone and web-based counseling. I mentioned before that there are free nicotine patches for qualified callers, and it's 5 sessions per attempt and 2 attempts per year. So you could technically say there's about 10 sessions per year. You could call 866-657-8677 or visit us at newjerseyquitline.org. We also have Moms Quit Connection, which is pregnant individuals, mothers, caregivers with a child aged 8 years old and younger. We also have been recently including caregivers of, whether you're a teacher, if you care for children under the age of 8, even if they're not your children, we consider you a caregiver. So if you're maybe an older sibling taking care of your siblings, a grandparent, an uncle, whatever, you're qualified for Moms Quit Connection as well. You do not need to be ready to quit for Mom's Quick Connection, and we have telephone and face-to-face counseling in your community, standard business hours, and unlimited sessions, as I mentioned before. We also have Quit for Kids, which is a program within Mom's Quick Connection, and this is for pregnant individuals or caregivers with a child aged 8 and under. You do not need to be ready to quit for this one as well, and you receive personalized text messages every week to help support your quit journey. This is also unlimited sessions, and you can text Quit for Kids to 53016, and you could also scan there as well. So, the New Jersey Quit Line, just a little bit more about it. As I mentioned, it's available for youth between the ages of 13 and 17, and also adults over the age of 18. We have a lot of youth services as well, so access to online dashboards with self-help materials such as TikTok-like videos, animations, podcasts, and quizzes. We also have access to chat with a certified quit coach, and we have some of the examples of topics covered include the health impacts of nicotine and tobacco, teens and big tobacco, the cost and financial environment of tobacco, social impact, which I'm sure affects a lot of our younger generation, is the peer pressure from other friends and other youth. We talk about triggers, substitutes, and distractions, and we also talk about, the reality of slips and how to stick with your goal once you have a slip. So we also have a lot of great tobacco trainings and education. We have our Ask Advise Refer program with the brief tobacco intervention model. It's one CEU for CHES and or nurses. And we also have an Ask Advise Refer Train the Trainer available. We also have Tobacco 101, which is learning about the risks of tobacco use, tobacco's impact on health and communities, and just general tobacco knowledge. We have Can We Talk, which is how to talk to youth about smoking or vaping. And this kind of teaches you how to talk to teens, younger individuals. Monica mentioned we don't want to be yelling at them or reprimanding them. We just kind of want to build that solid foundation with them, build that good rapport so they know that we're supporting them. We're not trying to punish them for something that isn't necessarily their fault. So this is a great way to learn a little bit about how to talk to youth. It's really great for teachers, for parents, even if you just work with kids. This is a great way to learn how to talk to them about smoking and vaping. We also have Get Ready to Quit, which is proven strategies and advice offered to individuals who are ready to quit smoking or vaping, or know someone who is. I've had a lot of people really like this. I've had people come back to me and say, oh, that made like 3 of our members consider quit smoking, and that was really nice to hear as well. So we're currently working on our Smoking in Pregnancy, which is a collaboration with the Prematurity Prevention Initiative to raise awareness and provide education about the health impacts of smoking on pregnancy. And we also, of course, have our Rinsey Raccoon Rides Tobacco Free. So it's a story time for children between the ages of 3 to 10 to learn about the dangers of second and third hand smoke. It's a really cute little presentation. We read a story, we show them a video, and they get a coloring book at the end of it. We also have our mascot, Rinsey the Raccoon. He's in the corner right here. And we also have a Train the Trainer available for this. So if you have any older students who are looking to become more involved with their community, we can train them in how to do this, and they can go out into the community, give these story times, and kind of build that further community with the younger kids in their area. So if you want to schedule, please contact us at tobaccofreenj@thecooperative.org, which Maya put in the chat. And a little bit about Tobacco Free for a Healthy New Jersey as well. So Tobacco Free for a Healthy New Jersey is New Jersey's largest collaborative effort to reduce the health consequences of tobacco use, the harm from secondhand smoke, and smoke exposure through prevention, education, and cessation. So some of the great work they do includes some of their policy action. So smoke-free public places, smoke-free housing, and their point of sale initiatives. We also have their community initiatives, including Tobacco Free Tuesday, which is their webinar about the dangers of tobacco and nicotine use. It's very informational. I highly recommend attending if you haven't yet. They have their Don't Get Vaped In presentation, which is for kids to teach or youth to teach them the dangers of vaping and, what vaping actually looks like and does to the body. And we also have Smoke Free AC. And then we have, for some programs, we have Incorruptible Us, which is Tobacco Free for Healthy New Jersey's youth program. It kind of makes students like student leaders in eliminating tobacco use in their schools. It's a really great program, especially because a lot of times we wonder if the kids are actually listening to us, but we know that they may be listening to their peers. So that's a really great program as well. And we also have NJ Quits, which is the college university initiative to eliminate smoking and nicotine use in colleges across New Jersey, and also our Working Well Tobacco Free initiative as well. So I wanted to thank you from the bottom of my heart for being here today. We really appreciate this is our first one, so we're happy to have you all here. And we highly, highly recommend you join us next month for another wonderful speaker, Dr. Brian Jensen. He's a pediatrician at the Children's Hospital of Philadelphia, also known as CHOP. And that'll be on February 19th at 10 o'clock, same time as now. And you could scan this QR code to register ahead of time. So I just wanted to open up the floor for Maya or Monica to say anything else. And yeah.
Just thank you again, everyone, for joining us today. We do hope that you learned something, and we do hope that you can help spread the word about this webinar series as well, because we, again, do want to continue to have these webinars and to provide information to the community and to professionals as well.
And I just want to say thank you for everyone that did join us. And by doing these webinars is how we're educating the public and getting the word out. So I had said before, education, education, education. And thank you.
And thank you, Monica, for your expertise and knowledge. I know that I've learned a lot from this, and I hope everyone else feels the same way. And I think together we can really improve the health of New Jersey, improve the health of our youth, of our adults, of our geriatric individuals. And I think that's kind of the point of doing these is to improve that health, reduce the impact of negative tobacco, and yeah, just like I said, improve the health. And with that, I'll let everyone go. I hope you all have a wonderful day, a great weekend, and I hope to see you at the next series.